Hello, hello, hello. Hopefully everyone can hear. If anyone jumps on here real quick, nobody yet, but if you could let me know, make sure audio is all good, and then we'll get rolling. Took a little break for the holidays for our Facebook Lives. Been trying to do this as a weekly stream, but took a little time off for the holidays. Got some deer hunting and a little relaxation in, and now we're back at it. So new year, and going to start the year off with one that I think is super cool. This is a case that I worked on with Dr. Jerome Smith, and we've done a couple of these, and it's not worked out yet to be able to do it. So this is the first clinical case I've done all the way through, and what we're covering is these custom designed zirconia membranes, which we're milling out and then using that as more or less a bone grafting cage. So you go in and you bolt this onto the ridge, and that allows you to now pack bone in, and it's a really nice way to do some bone grafting. And the results that Jerome got just absolutely blew my mind. So I thought we'd go over that today. See a few people on there now. Is everybody able to hear me okay? Still not great with this Facebook Live thing yet, and half the time I do it and there's no audio or something else stupid. So I want to make sure that everyone can hear all right. Um, all right, so yeah, if someone would let me know. Uh, Again, I just want to make sure that everyone can hear okay. But let's start out by just going over a few things. You know, we've got a couple of courses coming up, so if you're interested in this technique in particular, this is something we'll be covering in detail at myself and Danny Doming's full arch guided surgery, the advanced full arch guided surgery course that we give. If you go to digitaldentalmasters.com, you can find the sign up, and this is going to be under courses, and this is full arch guided surgery. And we've got options for in-person as well as virtual attendees, so should be something for everybody. But we've actually expanded this course. Myself and Danny have taught this course probably 10 times, and never fails that the problem we run into is just not enough time to get it all done. So we've actually doubled the amount of CE hours that this course is going to do. It's like 30 something CE hours. Much of it in the form of video content that we're going to send you before, so that you can actually do a lot of this stuff and get up to speed on some of the basics, because this course does get pretty advanced pretty quick. But we cover everything. We'll have options for the biggest digital geek, teaching you how to make stackable guides, all that kind of stuff, down to just routine swappable guides, but that absolutely work. We've done that for years now, and it's always worked great. So if you're interested in that course, again, go to digitaldentalmasters.com, and it's under the full arch guided surgery. This one's going to be in Vegas here in a couple of weeks, I think February 4th and 5th. And we're doing that at Dr. David Ting's office in Vegas. And due to COVID and uptick, we've got somewhat limited seating. If you sign up, that does come with the ability to bring an assistant or an auxiliary or a lab tech that you're going to be working with. That's included in your tuition, as well as for in-person and virtual alike, the recording of the whole course, as well as just tons and tons of content in the form of videos that you'll have to refer back to, because it's always a challenge with a course that teaches this much of trying to absorb it all just right then while you're in the course. So we found it to be a lot more effective if you got content to refer back to at the end of it. So take a look at it. Lots of stuff included with this. You will get CE credit, all that fun stuff. And then also we have some courses coming up with Transcend. So this is myself and Ben Kellum and Brian Correa. This is at our facility here in Huntsville, Alabama. And we just had our full arch guided course this past weekend, which was great. Next one coming up is January 28th and 9th. That is a little over a week away. And so this one's just for how to do full mouth rehabs. If you're like me, you come out of school, and that's definitely something no one teaches you about. When and how do you open the bite? How do you get the right records? How do you get a great wax up? How do you determine where the ideal endpoint is before you even get going. And we're going to do all of that in this course, show lots of cases, and then in particular, how do you do this digitally? Because there's a lot of huge advantages to doing a full mouth crown and bridge rehab digitally as opposed to the old school way, that make it far easier, that let you space treatment out over time. Things like staging the rehab, putting them in printed temps. Now that we've got permanent crown and bridge resins for crowns, you could put someone in a printed rehab on day one, in a single appointment, accomplish their rehab, and now you break it into a few teeth at a time. You put them in the crown a year club, if they're working with insurance money. So with my background and dealing with patients that didn't have tons of money to do these cases, I'm always trying to look at how can we do this affordable and make it accessible to our patients. And that's something we'll definitely cover, how to do the rehab in composite, or now that we're doing this in the printed materials, that's a much better option. Now, as always, I've been an idiot and didn't plug my computer up, so hang tight just a second. Okay, now we got power. Hopefully I will not screw this up anymore. So yeah, full mouth rehab course coming up here in just a little over a week, and then the next one after that is going to be digital dentures. This is learning the whole denture process from A to Z, both from clinical standpoint and from the digital aspect, and then teaching how to design both in Exocad and in Blue Sky Plan. And then after that, we've got March 4th and 5th, Exocad basics. And although it says basics, I know the last one, Ben is our primary Exocad guy on site. I use it, but I'm not as well versed as Ben. He'll be teaching that course. And, last time, even though it's a basics course, they were able to get all the way through designing a hybrid. So that's a lot you can get in that course. And then in April, we've got guided surgery basics and beyond. That's kind of our flagship course. If you would like to get into guided surgery, but kind of don't know where to start, this covers it all. From A to Z, you will leave that course knowing how to make all kinds of tooth-borne surgical guides, from simple to complex, up to full arch guides of just the most basic kind. That would be like directly on bone, simple swappable systems, or soft tissue guides. So we'll teach that in the basics and beyond, and then again, it'll all start over. And these are basically the courses we're repeating this year. And so we'll start back with full mouth guided surgery after that. So that's courses that are coming up. Let's jump over here to a PowerPoint. I'm going to double check. Can anyone tell me for certain if they're able to hear okay? I assume the fact that there's still a few people watching means that you can probably hear it, but anyway, we'll just roll ahead. So this is the case that we're going to be dealing with. This is the case Jerry sent me that, needs posterior implants, but there just simply was not enough bone. So we're going to show you the process we used and the actual clinical results that Jerry got. But hopefully you can see here, that's a lot of bone that we need to grow. And, in my hands, I was never able to accomplish the results that I was really happy with on these large grafting cases. And the results Jerry got on this, to me, are nothing short of a miracle. So it was pretty amazing. Couple things just to get started. We are making now at Transcend Digital Dental Lab, we're making stackable guides. So ours is the magnetic full arch guided system. You can kind of see some pictures. Thought I'd show a few pictures of a case recently completed. And this was a case done by Dr. Ford Gatkin, who a fellow UT grad here in Tennessee. So he sent us this case and was really happy with the result. I thought he got an amazing result, but this patient was just eaten up with decay. He had done a full mouth, well, not a full mouth, full upper arch rehab on this patient just 2 years prior, and now 2 years out, everything is decayed, recurrent. Had a long, hard conversation because, we're dentists. We like to save teeth, but this patient just kept getting decay. He was tired of investing in the teeth. without major lifestyle changes and pH of the mouth changes, all that kind of stuff, there wasn't a lot of hope that he was going to, have a better result if we just kept doing crowns. So Ford opted to go with full mouth implant rehab. And so this is just showing the lower arch. So when you use these guides, you'll go ahead and make your initial flap. And then this is a tooth supported guide. You'll seat this completely on the teeth. You've got windows cut out so you can know for sure it's fully seated. And that is going to position the reduction guide. The reduction guide is the foundation that everything else is going to sit on, magnetically attached. So you would seat this, take your pin drill, go ahead and drill your pin osteotomies, and then slide your pins in. And now that that is put in place, this is going to stay for the rest of the case. You can just magnetically remove this upper guide, just pops right off. And now you're going to do bone reduction down to the level of this guide. Okay, so this is after that bone reduction is complete. It's a really easy process. One of the things I'd point out about this is how low in profile this guide is. This is 3 millimeters thick from buccal to lingual and only 4 millimeters tall vertically. So a minimal flap is required. These always require a decent flap when you're doing any kind of full arch case, but it's really no more than if you were going to do a freehand case, and this is going to allow you to have a pretty atraumatic surgery. And you should, and this everyone I've talked to that's used them so far reports nearly doubling their surgical speed. So that's a huge benefit in of itself, because the faster you can operate, the less the patient's going to have swelling and pain post-operatively, the less complications we generally find. So it's a really great option for this. But here's after the bone reduction is completed, and then you would have a magnetic drill guide that would pop on. And so the magnets are for retention between the base frame and the other guides, but there's also 3 little indexing feet. And so hypothetically, we've done this with just magnets before, and if you really get heavy-handed, you might knock it out of alignment or something. So instead, we've got a tripod of indexing feet that the pin will go into a hole so it cannot move side to side, and then the magnets are there to retain them. They also make it great for when you need to switch these components out. You literally just pull up on it and it will release. There's about 10 pounds of retention with these magnets. So this is a great option. It really speeds up the swapping between guides. You can see now this is the implants in place. These were 6 Biomax implants, Blue Sky Bio implants, and this was designed for the fully guided keyless kit from Blue Sky Plan, which hands down is my favorite surgical kit to design with. We even have a ton of doctors that may place other brands of implants, but there's just a lot of the guided surgery kits that are on the market are not great. So I really would suggest looking into a keyless system, because it's going to really make it a lot easier to do the osteotomies, to get access in tight areas of the mouth. So he used the keyless drills, did his osteotomies, placed the implants fully guided through the guide. Here they are in place. And now he's put on his multi-unit abutments. Now he's put on his temp cylinders, and then you pick up the temp. And one of the unique things with ours compared to some other systems is that you can pick all 6 of these, or however many implants there are, pick them all up at once. So oftentimes if the implants are divergent, with many systems I've seen, you have to maybe pick up a couple that are closely aligned and get them done, then come back, maybe pick up the next 2 that are kind of aligned, and then the next 2. With this, there's a method we use to generate a common path of draw over all of these. So regardless of how the implants are angulated, the temp is going to seat over everything simultaneously, and you can pick everything up at once. And that pickup can either be done by just salt and peppering or injecting acrylic into the holes between the temp and the cylinder, or if a doctor requests it, we'll also make little injection holes on the facial where you can fill a syringe with acrylic and shoot it in, and that will fill up the space between the temp cylinders and the temp. And then, the recommended way that we suggest you do this is what I've learned in working on a million cases with Danny Doming, is don't suture until the end of the case. Because we designed the intaglio of this restoration to sit exactly 3 millimeters off of the level the bone is going to end up at with the reduced jaw. 3 millimeters is the perfect amount of distance, and we make that where it's ovate at a minimum flat on the intaglio, because that cleansability is incredibly important with any kind of case like this. So the intaglio is already designed to ideal, so don't suture before doing your pickup. Wait until after the pickup, and now that everything's in, you're ready to deliver the temp, deliver it. I always, if you've got the ability, I would recommend doing some PRF over every implant to help occupy that space between the temp and the bone. And then don't try to get primary closure with your flap edges, just suture the flaps to the temp. So, myself and Danny have published this. This is what we call the full arch healing abutment concept. Again, the idea is that the temp is designed to be the perfect cleansable shape from the start, and you're just going to suture the tissue to the temp, which means the tissue is going to conform itself to the shape of that temp, which is already ideal. And as a result, you get a huge gain in keratinized gingiva. You get cleansable contours. It's just a far better option than how I see most people do this, which is to suture everything up around your multi-units and cylinders and then pick it up. If you do that, you're going to end up with non-cleansable contours on this, and that's not ideal. Okay, so this is kind of the idea. Now you would just do a horizontal mattress suture. Myself and Danny, when we do these cases, just do 3 sutures. That's it. One on this side, one on this side with a big bite, and then if the flap is moving when they move their tongue, then a midline one as well. But that's it. Okay. Now the other thing, so again, that's all kind of intro into what we're really going to be talking about today, which is custom zirconia membranes for ridge augmentation. This is a service that we provide through Transcend Digital Dental Labs, so if you're interested, you can go to our website, open an account, and then submit files digitally, and we can just do the design. You can do your own milling, or you can have us do all of it, whatever you prefer. Now the starting point for one of these cases is you're going to have to segment the jaw. Okay, so great time for me to mention a new service that few things have made my life simpler in the last 5 years than discovering this software, but it's a company called Diagnocat. And what they've got is an AI software system where if you upload your DICOMs, it only takes about 8 to 10 minutes to do full segmentation, and that's upper jaw, lower jaw, airway, individual teeth and the roots, the soft tissue. It's incredible, and it takes, again, 8 to 10 minutes. It's like $49 for this, so it's cheaper than all the other segmentation options that are on the market. Not to mention, it does an incredible job. It's really amazing. So just to show you a few things, this is a case I recently worked with Dr. August de Oliveira on for the magnetic stackable guides, and you can see this is the segmentation. This took 8 minutes to generate, and we got a complete jaw segmentation. Usually if I'm doing this myself manually, it's going to be a pretty small segmentation because it takes a lot of time to do this well, so I'm only going to do the areas that are critical. But super cool that with this, it just does it all, and honestly does a better job than what I can do myself manually. You can see the tissue here as well. In August's case, he had facial scans as well, and this makes it super easy to stitch in your facial scan. You can use the nose, the eyes, the lips, all that kind of stuff. But you see the individual tooth roots. This is looking from the back. You can see the airway, and so that's pretty cool. You can slice through this, quantify exactly the surface area that they've got in their airway. It helps diagnose airway problems and all that. And again, this is just showing the model outline so you can see how accurate that segmentation is. It's dead on perfect. Really, really amazing service. So I'd highly recommend them. This is just another case example. This is a case I'm working on for Albert Zickman, who's one of the owners of Blue Sky Bio, making some guides for him. Again, this one, the soft tissue is not as good just because of the way they're positioned in the machine, but you can see the actual bone segmentation is incredibly accurate, all the tooth roots and everything. So big fan of this, and if you're going to make one of these zirconia membranes, the bone segmentation is the starting point for this process. So this is an excellent option for you to do this. I'm the world's tightest dentist. I'm so cheap on stuff. I'll do it myself if it'll save me a little money, but man, this is such a time saver that I am more than happy to pay for this, and it's just an amazing service. If you're interested in doing this, you can go to the Diagnocat website that I showed previously, Set up an account on there. Once they approve your account, now you've got your portal. You can upload your CT, and you can do different types of segmentation. Another super cool thing is you can do radiological analyses. And so what this does, again, it's all AI driven. It'll spit this out as part of your service that you've paid for, but it will generate a radiologic report that goes through the jaws and through every individual tooth and tells you potential pathology. Now, this is not yet FDA approved as a true diagnosis, and it shouldn't be used as that anyway, but it does give you a really great head start. If you've got something you're a little concerned about on a CT, this will give you a differential diagnosis that you can then go and verify, or maybe you decide you want to send it out for more analysis by a radiologist. Again, the cost is $49. I know that the pricing model is shifting very soon to per arch, but for right now, it's $49. It includes everything, both jaws, airway, all tooth roots, nerves, and their soft tissue. Again, it takes about 10 minutes. And the way the segmentations work is kind of how, if you're familiar with Blue Sky, the way the export system works. You just purchase so many exports, and now it just deducts them as you use them. Similar on this, you'll purchase a bundle of segmentations. The more you get, the lower the cost. But then as you use those up, it just deducts one. So I'm a big fan of this. The company's been kind enough to give a discount code. They know I present a lot on stuff using segmentation, so it was a good fit. So they gave me this code CG2022, and that will enable you to get your first case done for free. And then there's a discount ongoing with that. Again, here's their website, Diagnocat.com, and then you can go to log in, US space or European, Russian, whatever you're in. And this is how that portal looks. I've just colored out the patient names here for HIPAA compliance. Excuse me. But you can see I've done a bunch of cases, and this is a long thing that you can scroll down because I'm just using the heck out of this now. But you would just upload their DICOM, tell it what you want, and then it would generate it. This is again an example of a specific case, and you can see we've created radiologic reports, we've done the STL segmentations, all that kind of stuff. And here's just a picture of the radiologic reports. Again, it'll give you a pano view and tell you what teeth are present and missing, and then it's going to go tooth by tooth and show you everything that's in there. So can't say enough good things about this. It's incredible. All right, so let's jump into our case that we're actually focusing on today. Hopefully everyone's had time to join in now. So again, we're looking at doing custom zirconia grafting membranes, and hang on, I'm going to try to see if I can find where comments are on this so that I can be watching for them. And I don't see it, of course, so whatever. We'll just keep rolling. If you got a question, I'll try to answer it in the comments afterwards. So this is our patient. She's missing those lower posterior teeth. Ridge is really inadequate to place the implants in. And I want to say on the outset, all this clinical case was done by Dr. Jerome Smith out of Lafayette, Louisiana. He's partners with Dr. Danny Doming at their practice. Both of them incredible implant surgeons in general, GPs, but man, I'd put their work up against anyone in the country. In fact, the biggest thing with this case is I was so amazed at the results. It's hard for me to discern whether that's just the fact that Jerome is an absolute wizard and these results are dependent on his incredible surgical skills or others. So I'm looking forward to getting a bigger caseload of these and kind of evaluating how it works for us mere mortals. But here's cross section, and we'll go through the CT here in a moment. But look here at where the implant that I've proposed is. That's where it needs to be ideally from a prosthetic standpoint. And the ridge is not even close. She had a lot of bone loss after the extractions. Most of the bone is over on the lingual, and we're needing to gain a lot of width and then also some height. Okay, not an easy thing at all to accomplish. So to see the results that he got is just amazing. And this is what we're going to be designing. You know, these are the custom zirconia membranes. And so, you could make these out of any material. You could have it 3D printed in titanium. You could mill it in titanium. We ended up going with zirconia, one, because zirconia is so easy to mill. It's really affordable. You get 10 of these membranes out of a puck of zirconia, which only costs 70 bucks. So if you break that down into the cost, these things probably cost us $5 to $10 per membrane to make. And should also mention that we didn't actually do the milling of these. This was done at his partner, Danny Doming's lab. So Danny owns the Louisiana Dental Lab in Lafayette, and we just sent them the files. They milled this out, and so this is certainly something that they can do as well. And again, cross section, little zoomed in, look at the amount of bone loss that has occurred and where that implant needs to be. So if you're looking right here, this is a 5 millimeter implant, which is what Jerry wanted to use. We're just not even close. Look at this. This is probably 8 millimeters of vertical augmentation that has to be accomplished. And using bone blocks, using hand formed titanium meshes, all that kind of stuff, you could get some bone growth, but I don't think you could get as much as what we're going to be showing here. Okay, so after I got it designed, sent the design to Danny, he milled this out at their lab. This is it in the zirconia puck. And they also told me on the front end what surgical screws they were going to be using. These were the Tatum screws. Gave me the dimensions of them, and so you can see here there's 3 sites to screw this membrane into the bone so that it's rigidly fixated. And one of the cool things about this is that you actually place the membrane first. So the perimeter of the membrane is designed to intimately fit against the bone on an area where you're not going to augment. And so when you put this in, it's going to go into place very solidly. And then these screw heads are inset so that you can screw this thing in. And then they were centered. And here they are on a model just to try and fit. And then surgically, again, he just opened up, laid a big flap, found the way they fit, which is easy to figure out. And then he packed the bone. After fixating this in, he packed the bone through the membrane. Okay, if you tried to load it with bone first, you're never going to get it to seat intimately. By doing this, you can actually just pack it in after the fact. Okay, here's the post-op cone beam showing it. All right, so you can see a great intimate fit there. And now he did have a membrane exposure, and typically if this had been titanium, it's a nightmare because it'll adhere to plaque, it will get all messy, and you'll have loss of your graft and everything. But with this, that zirconia is so smooth and nothing adheres to it that he was able to just keep it clean. They used not chlorhexidine, but it'll come to me. There's another antibacterial solution that they'll use. So just kept it clean with a Q-tip and went back afterwards, removed the membrane, and look at this ridge that was generated. Okay, so this is a 5 millimeter implant. This is the size I proposed initially. And if you remember, the bone didn't even come to right here. And this is healthy, vital, bleeding bone that he was able to place this in. Incredible result. So anyway, very impressive. He was able to get 4 5 millimeter implants in, and then here is the case restored. Now it was a long turnaround time, right? This patient had to heal for 6 months, but the end result is just absolutely amazing. And here again you see it, 5 millimeter implants, custom abutments, again made by Louisiana Dental Lab, and then zirconia crowns on top. Okay, so that is what we're going to be teaching today. So let's do this. Let's go to the cone beam and I'll show you how I work this case up. All right, so again, we're always starting from the prosthetic endpoint. So the initial step was to plan out the ideal tooth positions. Okay, and then we planned the implants backwards from the prosthetic positions, really with disregard of where the bone actually, excuse me, hiccups today. But we designed the implant positions without regard of where the bone actually is. This is where we would like them to be. And so once we know that, we can start getting an idea of how much bone grafting is going to be required. And if I was to turn the transparency off on this, you see that's where the implants need to go. That's where they ended up. And again, you saw this, the picture that I showed a moment ago was of this side, and around this 5 millimeter implant, you saw all of that bone. So again, burn this image into your mind. Now let's go back and look here. This is what was accomplished. Now you tell me another technique that will consistently get results like that. Just absolutely blew my mind. And again, I'm sure it plays into this that Jerome is a wizard and can do things that most people can't. Guy can grow bone out of thin air, but still, that is just absolutely impressive to go from, again, here to here. Okay? So let's get into how we design this. All right, so implants are positioned. If you want to see that in cross section, let's click on this implant. And if I spin around here, now you're looking at it in cross section. So lots of bone loss here. And this is what we're going to try to grow. This is what he did grow. Okay. So now that we know where the implants belong, we need to do the bone segmentation. Again, this is where I would kick that out now to Diagnocat because they're going to do a great job. Notice with my segmentations, I do not go, this was one prior to using Diagnocat, and it's really, really a lot of extra work to go in and do the individual tooth roots. So I end up always just doing it all as one object, the bone and teeth in one. But you know, they're going to actually do this with individual teeth. Okay. So we've got the implant positions, we've got the segmentation. So the starting point of this is that we need to redesign this jaw to the ideal contours. So to do that, let me show you how we would start that. Okay. I was a little rusty and hadn't done this in a month or two, so I went back and practiced. This is where we're going to be heading for. Okay. So let's turn those off. Starting point would be go in and let's export now this jaw and all of these implants. Okay, so file, export data. Don't need the nerves, just the implants and that tooth, or that jaw. All right, so I'm going to call this mandible and implants. And now I'm going to go and open that. Oh, you know what? So right off the bat here, I'm already being an idiot, and I forgot to show you an important step. Before we do that, actually, so you do still have to do the segmentation, right? But before we do that, this has got to have a path of draw. You can imagine if you build this in where it's got an intimate fit on this perimeter and then wraps up under here, how do you ever get that installed? And then let's assume your bone graft works. How do you get the membrane off? You've actually got to have a path of draw when you do this. So to generate that path of draw, what I do is I go over to denture module. And this is just a hack that I use to make the denture module give me that path of draw. Okay, so it's the first step in a denture design process. So I'm just going to add a couple of teeth. It doesn't matter what. You just need at least 2 of them. Drop them in there because in order to let you design a denture, which is what we're going to do for the hack, you've got to have a couple of teeth. So there's our teeth, and now in the denture design panel, we're going to design, quote, a denture on this segmented mandible. We're going to create the denture now. And so what I'm going to do is look at this, and I'm thinking of a path of draw of how would I insert this. Okay, so I want to see the entire buckle of that ridge where most of this is going to actually happen. So I'm looking from this. I don't mind if it comes in a little from behind and seats, but that lingual undercut is certainly something we've got to account for. So right there, I can pretty much see everything on the buckle of the ridge. So I'm going to tell it to set my insertion direction from this view. Okay. Now when I rotate up, I can see there's no undercuts present on any of the area where this membrane is going to go. Obviously, there's a lot of lingual undercut. So when I click next, as first part of a denture design process, it's going to apply those undercut blockouts, and this now is the model that we want to export. So at this point, I can abandon this process. I was only doing that to generate this particular model. So now I'm going to go to File, Export Data, and all I want is that undercut model and those implants. And you know what? Since I can't do implants in surgical or in denture module, I'm just going to jump back to surgical guide now. I'm abandoning the denture process. Hide the teeth. This is what I want to export. So File, Export Data. And actually, I'll do the nerves too, just so I can see where those are to keep my membrane away from them. And so I'm going to call this mandible and implants. Overwrite the one I already created. And now I'm going to launch a new mesh mixer window, opening that model. Now when you export those all together, it's going to make them all into a single STL. Now it's a single STL made up of a bunch of different face groups, let's call them, right? So if I was to click on this and then hit E, which is expand to all connected, you can see it just is selecting the jaw and not those implants and nerves. So with that selected, hotkey is Y to separate that off into its own STL, and that's what I want to do here. Okay, so we're just going to tackle this one side to help you grasp the process, and then it would be the exact same for the other side. So here's my starting point, is I need to indicate an area that's going to remain unchanged on the ridge where the perimeter can sit. Okay, so I'm going to get real close to this tooth, and I'm going to come down, stay clear of that nerve. And then looking from the lingual, there's not much point in going real deep beyond the undercut. So I'm going to more or less follow that undercut right here. All right. I'm going to hit O to optimize the boundary and B to smooth the boundary and accept that. All right. So right off the bat here, what I'm going to do is duplicate this jaw. I always want to keep one that is just going to remain untouched and unchanged throughout this process. Okay, so I'm clear of the nerve, and now basically all of this white area between the green membrane, that's what is going to get reshaped. So to do that, we can do multiple things. First of all, it's going to be really difficult for me to start using sculpting tools without accidentally rolling onto this green part. So if I just select this white face group, I'm going to hit Y, and now that's its own STL. You can see now I could turn that off. And what I can do from here is just start reshaping this. Now there's a lot of ways you could do this. You could use a bridge tool and bridge from say here to here. What I'm going to do here is just use the inflate tool, and I'm going to start inflating this around those implants until I've got a ridge of the contours that I would like. So inflating. All right, I might as well just start by just getting the vertical height that's necessary. And you're probably going to do like that and create some wrinkles. You know, if you do that, you can just hit it with the smooth tool and get those areas where the mesh is crossing over itself taken care of. Back to inflate. And I'm just continuing to inflate this jaw up to ideal contours. Now I'm going to work on the buccal because I need to make sure I've got 2 millimeters of bone on all sides of the implant. Creating some more of those wrinkles in the mesh, so I'm going to go smooth them out. So you can see my tool is, if I hadn't have separated this, I would definitely be rolling over onto the edges of that mesh that I need to remain untouched. So I think that's an important aspect to this is that you separate this mesh off into its own thing. Back to the inflate. All right, that's about ideal on vertical height. Smooth it. And I've about got what I need on this lingual. Maybe I could inflate this just a hair more. Okay, I think right there is going to be more than enough. That's about the extent of what I do on the lingual. And now I just need to continue on the buckle. Let's inflate. Smooth it. You can see this is not a very delicate process. I'm just eyeballing it, and I'm just thinking in my mind, like, if I could make the perfect ridge, what would that ridge look like? Okay, so that's what I've got in mind, and now I'm just using the tools to turn that ridge into the shape that would be ideal. And I think that's good enough. You know, if I was really doing this case clinically, I would probably take this back into Blue Sky Plan and look at it in some cross sections. But, you know, for a demo, I don't think it's that critical that I do that. Okay, smooth edges. There we go. Now, if I wanted to, I could go to shaders and put a transparent shader on this, and I could see this where those implants are falling underneath it. And that's looking pretty good. I can get an appreciation for the width. That gives me a couple of millimeters of bone around the implant. I think I could inflate a little bit right here and right here. So I'm going to do that. Let's go back to a normal shader and inflate. And there we go. And I do think it's important to have this be as smooth as possible because, again, rough edges are going to make it that much more prone to getting, you know, an exposure during healing, which we got here anyway. And although it didn't seem to matter in an ideal world, I'd say let's try to avoid those if possible. Okay, so this is my ideal area of the ridge now. So now I can start turning this into a membrane. Okay, starting point of that is that I need to separate off, or I'm sorry, combine back together and then rejoin this. So I'm going to click the jaw and this in my objects browser and combine them. And now I need to join them back together. So I'm going to use my select tool and I'm going to zoom way in here. I find it useful when I'm trying to select just the edge. You can hit W in Mesh Mixer, and that's the hotkey to turn on the STL wireframe. Shows the triangles, and I'm going to select the boundary there. I'm going to select the one triangle of the boundary here. Double click it. That gets me the whole boundary. Right. So now with that done, I'm going to hit O for optimize, B for smooth boundary. And now I've got those boundaries selected. Now I'm going to hit J, which is join. All right, there we go. And then while that's selected, just to make a nice smooth taper into that green untouched part, I'm going to just smooth this. So I'm going to expand the ring, shift greater than, and now go to smooth. And then increase the smoothing scale to make a nice taper in. There we go. Okay, so that's the area that's going to be the membrane. And the boundaries of the membrane are going to be this green edge, which will sit directly on the untouched bone. This is all going to be, you know, having space underneath it into which you can apply the bone. If you wanted to see actually the difference in how much I've added, so I could come in here and maybe, just for demonstration's sake, do a plane cut, let's say through that area. Okay, and now you get an appreciation of how much is being added. Plenty of vertical height and a good bit of horizontal augmentation. Okay, so now what I want to do is select basically all these colored areas. So an easy way to do that is to just select the white part, hit G, which is expand to groups. That selects all the white, but then I can hit invert and it deselects that and goes to my part that I wanted to do here. Okay, so that's selected. And this membrane needs a little bit of an offset spacer. Think of a surgical guide. You know, every time you make a surgical guide in Blue Sky Plan, it builds in by default either a 0.2 or a 0.3 offset spacer. So I'm going to go with a 0.3 offset here. Let's make that be 0.3. Let it refigure. There we have it. All right, there is the intaglio of the membrane. Now it's all still part of this STL, so while it's still selected, I'm going to hit Y. That separates it into its own. And now I'm going to come in and just barely touch this. I'm not going all the way out to the boundary. I'm just getting rid of some of that wrinkle that didn't iron itself out earlier when I applied that. Okay. So I barely touched that. It's not going to really alter the fit any, but it's going to just smooth things out slightly. All right, there's the intaglio of the membrane. This currently is a one-sided mesh. If you look at this, that's not an object you could print or mill. It has no thickness to it, so we've got to create that. You could do this a number of ways. What I'm going to do is select all, and I'm going to go and offset another distance, and this time I'm thinking, how thick do I want to make this membrane? Well, because zirconia has to be milled in its green state and it's going to be a little weak, I think a 1 millimeter thickness is going to be adequate to give it some strength during the processing. Okay, so there's a 1 millimeter offset. Now I could hit connected, but I'm not going to do that. Let's look at what it would look like if I did connected. Okay, it works, but it's a little bit rougher and you tend to get some spikes here where the meshes don't perfectly align. So I'm going to not do it as connected, and instead I'm going to just save this, and this allows me, while this is selected, to first of all smooth it, because I want the outside where it's going to be in contact with tissue to be very, very smooth, as smooth as possible. Could even come in here and use the smoothing tool and further go over this. Okay, so again, I don't want to roll over and hit this one. So before I do that, I'm going to just select this, Y, separate it so I can work on this one without altering what's underneath. There, that's what I'd really like. Any kind of little rough spikes that you're seeing, you can smooth off. Okay, that looks good. I went a little overboard right there, so I just Control Z to undo that. And then beyond that, one thing I could do is I could even come in and maybe select this boundary, shift greater than, and I could just maybe delete that part. And now when I join this, it's going to make those edges not stick up so much. Okay, so let's combine these back. Combine. I want to join these edges, which means that all this surface needs to be flipped inside out. So select it all, edit, flip normals. All right, now we've got two sides to this STL, and now I'm going to select just the edges and join them. So that edge, O, B for smooth, and then J is join. And you see what it does there? Now we have the initial membrane. If I turn the jaw on, you can start to see this. Okay, so there is step one. Now we want to make those holes in it that you can pack the graft material through, but Before I do that, I need to strategically position some screws, the retention screws that will screw this membrane into the bone, because if I make all my holes on the front end and then try to apply them, my holes might be in the way of one another, all that stuff. So what I'm going to do is just save this right now as is, and I'm going to call this initial membrane, and I'm going to pull it back into Blue Sky. So file, import STL, and here's initial membrane. Don't stitch it. And now let's look at this in cross section. Okay, so there's my initial membrane. I've got the hint turned on, and let's go over to this side. So now I could see this thing in cross section, and you really get to appreciate now how much is being added. Okay, and this is actually maybe a little more than I really did clinically. Again, I'm doing a quick and dirty job here. Okay, so now let's think about where we want to position screws. So I need to go back here and remind myself, what is the thickness of the screw? So it's 1.45 is this area, and then the head is 1.75. So let's now add, I'm going to add a pin. All right, but I'm not going to use the Blue Sky pin. I'm going to use a custom pin, and now I can just make the diameters be correct. Okay, so diameter is 1.45 is real. Let's make it 1.6. And length, I would say he's probably going to use a 10 millimeter lag screw. Let's say the head is maybe 2 millimeters. And that's just visually going to give me an idea of where I can apply this. Okay, so probably going to stick one pin, or I call it pin, screw, retention screw. Now remember, the implants are not going to be in place there when he's initially placing this. This is a two-stage. I would probably not recommend at this stage in doing these trying to place the implants at the same time. Okay, so I'm trying to just think about, okay, where can I put this pin? Okay, these other implants really could be turned off right now. And let's just get an idea of how we're going to bolt this thing in place. So first thing I'm noticing is he's probably going to have to drop down to, say, a 8 millimeter screw. All right, and looks like right there would get him a really good bite. And then spin it on its axis. That looks good. It's right in the edge. Could maybe even come in a little more from the front of the mouth, like you probably will have to surgically. So there's one screw. And I'm going to try to position, let's say, 3 of these. All right. So let's do one there, one back here, and then one at this lower boundary. So now I'm going to duplicate this. Duplicate, pull this over towards the distal. And again, you could put these in a million different places, but you need to be thinking from a surgical standpoint, can I actually get it there? Am I going to be able to retract the cheek enough to get in there to screw this thing in place? So maybe there. Okay, this one, by the fact that I've tilted it toward the buckle a little bit, he should be able to get that one in. This one should be fine. Let's look at it from this dimension, and clearly I'm in the nerve. That's not going to work. So probably need to tip this up to avoid that nerve. And again, I'm thinking now 8 millimeter screw length is going to be appropriate. And then let's do one more, duplicate, and pull this guy down here. And let's make this one coming in more or less from the buckle. And I'll get down here close to the boundary. Again, from a surgical standpoint, easier coming in from the lips to get more of an angle like that. And toward the front of the mouth. And now let's look at that one in all dimensions. And here again, in the nerve, that's not going to fly, so now I need to reconfigure my positioning, and I'm going to have to get up more like that. Okay. Now what's interesting, if you get concerned about eyeballing this and thinking, man, as I'm drilling the little hole for these, am I going to get off and hit the nerve? You could make a surgical guide just for drilling your pinholes. You know, find your pin drill. It's probably a 1 millimeter drill. Make you a little surgical guide so you can accurately drill those and not have to worry about that. So let's look here. Within bone everywhere. That one looks like it's going to be perfect to use a 10 millimeter. These other two need an 8 millimeter screw. That's where we're going to say we're putting our screws. Okay. So file, export data. I'm going to export those screws. And right there is the 3 that we want. So back to Mesh Mixer, we will pull those in, import. There's my 3 screws. And so right off the bat, I know that I need to subtract those out, and that's going to be the area for retention. Now, I'm not going to do it here just for sake of time, but if you'll notice on this, I actually even, I reshaped that to where it was similar, and I made a shape in Mesh Mixer that had a similar screw head to that. And that allowed me to inset these screws. So you could do that. I'm just not going to do it today for the sake of time. Let's just make a straight up hole for this. All right. So we've got this shape. If you look at the shape of these, things like implants, guide tubes from Blue Sky Plan, those are files generated in a program probably like SolidWorks, more of an engineering style software, and they're going to tend to have these ultra long triangles. And I suppose that's a more accurate way to generate this shape, but it typically doesn't perform as well if you're trying to do like Boolean functions, especially when your shape you're subtracting from has really regular meshes without elongated triangles. So what I like to do is I'll either remesh these. I don't want to change the shape, but I do want to create a mesh that's more similar to what this is. So an easy way to do that is just to go to Edit, make solid, and now it's got a pretty similar mesh. It loses a bit of quality, which we can improve, but it doesn't matter, frankly, for what we're doing here. So right off the bat, I'm going to subtract these screws from this membrane. So select the membrane first, Control select the screws, Boolean difference, and now I've got my holes to fixate this. And now that I know where those belong, I'm going to start making the more or less a cage shape to this. Okay, so I will use just the select tool, and let's say, now there's a lot of ways you could do this, but what I'm going to show you is what I feel is a good option that's kind of a shortcut on this technique. Okay, I want to leave the perimeter more or less untouched, because again, that's where it's going to get its fit from. And I'm going to just outline where I would want the holes of this cage type mesh to be. And when I'm making these, I'm just thinking about, is that big enough that he'll be able to get in there with his graft packer and condense this graft. Okay, got those. And now we'll start doing this buckle area. And it doesn't all have to be an exactly uniform shape. You know, these holes can be whatever the heck you want them to be, really. But I am just being mindful of trying to keep this, you know, where there's not any super, super thin parts, okay? Like right there, if I make that too close to this screw hole, then that's going to be a really thin part to the zirconia. And now I'm just expanding the shapes of these holes. Again, make them however you want. Okay, with that done, O, B, and what I'm seeing here is that there's areas that basically they're too close to one another. All right, so um, first of all, I'm going to just hit Control G. All right, that saves these as a face group. You see how those are now all their own color? And what I'm going to do is I'm going to hit Control A and remesh this whole thing to have a little finer mesh. All right, and let's turn up the triangle count or the density. There we go. And now, if I was to come back and just select those individual face groups, I bet when I do that smooth, it's gonna not give me an error like I was getting. So O, B, now you see it works great. All right, so here's the way I'm making this, the holes in this. You know, I've selected the areas where I want them. I'm gonna start by going to Edit, Offset, and just offset it a slight amount, 0.15. Okay, now you see those. I'm going to hit Y, separate them into their own mesh. And because don't love these kind of roughened edges, I'm going to get a smooth tool there. And I'm just smoothing these with a single touch. All right. Now I need to make those into a three-dimensional mesh, which can be subtracted from this. So easy way to do it, Control A, and then let's extrude. All right, so D is the hotkey for extrude, and you can see if I go in a positive direction, I'm extruding outward. But what if instead I did a negative number, something like -2? Now it extrudes inward. All right, and I could even go a little less. Okay, that works. Now that's a three-dimensional shape, and I can simply subtract that from the membrane, Boolean difference. And there you have it. Now, without all this talking and stuff that I've been doing, I find these take me about 15 minutes to design, and then it would simply be a matter of milling that. Okay, so a lot of digital techniques, you know, to get into fancy stuff, stackable guides and stuff, there's a lot of design time. And I certainly understand if some docs say, you know what, that's just really beyond the amount of time I'm willing to spend on this, and either outsource this or just freehand it, whatever. But man, this, once you have a grasp of these tools, it is so fast, you know. And if you've got a mill or access to a mill, or crap, I know there's a million labs that you could just send this design to and they'll just do a custom milling job. Um, you know, your cost ends up probably being less than a single collagen membrane. So this one to me is a no-brainer. This is just easy stuff. All right, so let's save this. We'll call this final membrane patient left, so we know which side is which. And now in Mesh Mixer again, or in Blue Sky Plan again, I can pull that in. Import STL, and there's final patient membrane. So you can see it's the same shape as the initial, just now it's got the holes in mesh. So let's turn off that one. And here is our Zirconia grafting membrane. Notice how intimately it fits all the way around on the borders. Okay, so you would simply lay your flap elevated enough that you can get down to this area, expose the nerve so you can see it, know you're avoiding it, and then this is going to sit on there and fit like a glove, and you just hold it in place and now screw in your lag screws. Now that it's fixated, take your bone graft of choice, and I know that what Jerry used was uh, Maxius freeze-dried bone, I think a cortico cancellous mix. And then I don't know, sometimes he uses PRF and mixes it with that to make kind of like sticky bone. Oftentimes he'll also just forego the PRF and use Fusion Bone Binder. That's a great product that he's used forever, turned me onto it years ago, probably 10 years ago, and I used the heck out of it. But it's available from Woodland Hills Pharmacy out of California. They can ship to most states in the U.S. And what it is a two-component system. They're in two lurid lock syringes, about 20 bucks, so it's not a big investment. And it's a liquid component and a powder component. The powder is calcium sulfate. It's just medical grade plaster, right? Which has got tons of support in the literature for bone grafting, and is an additive to bone grafting mixtures. And then the liquid component is carboxymethyl cellulose, which gives it the putty consistency. And then there's gentamicin liquid mixed in there. And so the way I would use this when I used Fusion, was working clinically, is I usually would just take a half cc of bone in the little Dappen dish. I'd dump in all of the powder and typically about half of the liquid. And usually that gave me the ideal consistency. It was a great putty that held together, kept the form that you shaped it to, but wasn't all dry and crumbly. And it makes your bone graft go farther. It actually, that calcium sulfate is going to resorb a lot quicker than the bone particles. So as it resorbs, it leaves a matrix into which blood cells can infiltrate, and you get a really great response from that stuff with bone healing. And so either use sticky bone or Fusion Bone Binder and cancellous cortical mix, and then just pack that in. You got it mixed up, and now you're packing it in through the holes that are in this membrane, and you pack it until it's really well condensed in there with no voids or anything. And now think about what this membrane is accomplishing. The biggest problem that causes issues in bone grafting is either movement of the graft or pressure on the graft. Either of those will cause it to resorb and you'll just not get any bone growth. With this, once the membrane is screwed into place, this is completely rigidly fixated, so there's no chance of you getting movement of this until you physically go in at second stage and remove those screws and take the membrane out. Worth noting too that because we did that path of draw, when you remove this, it should just slide straight off the bone. Okay, so I asked Jerry about that because I was curious. He said there wasn't any problem. He didn't have to cut the membrane up or anything. It just pulled right off. So it's not like this is going to integrate in that amount of time. I do believe he did either 4 or 6 months. I want to say 6 months on the healing time. But we've solved the problem of having any potential of mobility because it's rigidly fixated. And then secondly, there's no chance at getting pressure on this graft because this is zirconia. It's rock hard. If they're applying pressure with their tongue or at nighttime laying on their hand and it's pushing on that area, it's going to push on the membrane, but it can't get through and apply any force to the graft below it. So, you've got both of the main issues with bone grafting solved here. The biggest technique sensitive thing of this technique is that you've got to get enough release on your flap to get primary closure. That's always an absolute in any bone grafting procedure to get ideal results, is that you've got to have tension-free closure, which means smart flap design and then being able to go in and release that flap. You can get a tremendous amount of release on your flap and get that tension free if you know how to do it. Making the little periosteal slices, which will make it where now it's just the mucosa that can stretch a ton, whereas periosteum doesn't really stretch. So you make those periosteal cuts, relieve your flap, and now that should stretch over. And then I would recommend probably doing like a double closure. So I need to ask this of Jerry because I don't remember, but I'm pretty sure that he did over the top of this either a collagen or a pericardium membrane, and then some PRF over the top of that. Because the PRF is just going to really help if you have an isolated area where that incision opens up. Now you got already a big fibrin clot there to help bridge that and let it heal over. Plus, you just get incredible soft tissue healing with with PRF. So that would be the surgical technique. And then the other thing I should have mentioned before you even, you've laid your flap, before you apply this membrane, you need to decorticate this because, obviously you're going to get a little bit of blood supply from the periosteum, but not ideal. And it's better to have your blood supply coming from the underlying bone. If this is just left as cortical plates, you're not going to get that. So you need to go in and aggressively with a small round burr or something, punch a bunch of holes all through the cortex of this where you need that blood supply to get to your graft. Okay, so punch a bunch of holes in your cortical bone here till it's bleeding, and then you can screw this in and now pack your graft into it. Tension-free closure, then let it heal, and then come back and you can take this off and just apply your implants or place your implants. I don't know how you apply an implant. Okay, and so again, going back in light of that, you can see here the lag screws in place, and you can see the bone has been packed in very thoroughly into the site. Let that heal up, and then again, you can see here where he did get, even though he had tension-free closure, sometimes it happens. We're adding a tremendous volume here, so if you get a little bit of membrane exposure, as long as it can be kept clean, then I would roll with it. I would leave it in place. And again, zirconia is ideal for this material-wise because nothing sticks to zirconia. That's one of its biggest benefits. I mean, plaque doesn't adhere to it. It can be highly polished, and so it's going to be much easier to keep clean. Better tissue response. It reminds me of like when if you've ever used like the Teflon sutures as opposed to say a chromic gut. I mean, you get a little inflammatory response around that chromic gut, but around the Teflon, I mean, the tissue acts like it's just not even there because nothing sticks to that Teflon as far as bacteria is concerned. It's not inflammatory. And again, just showing the end result because this just blows my mind what he was able to achieve with this. Huge amounts of bone growth. Now, again, there's other techniques you can do, tunneling techniques, sausage techniques. There's a lot of different methods out there, block grafting, all that kind of stuff. But to me, this is the least technique sensitive, and the results just again, I need to get more cases to make sure it's not just that Jerry's a wizard and sold his soul to the devil to be able to grow bone out of thin air, or if it's just that it's consistently going to get that result. I would imagine it's somewhere in between those two options. That definitely helps that Jerry's as good as he is, but I think this also dumbs this process down enough where it's achievable by most people. As long as you get that graft or that membrane really well fixated where it can't move, and as long as you get tension-free closure, I think this is results that most people could achieve. Okay, so again, I wish I had dozens of cases to show you. This is a new enough technique that I've not got that case load, but we're looking forward to trying more of these, and I think we're going to see consistently good results with this because I just don't know of another way that you can consistently get these results. So that's it. Let me try to see if there's any questions, if I can actually find those in Facebook to see if there were any questions. Don't see any right now, so if there are questions, this is going to be up and I'll share it a few places. I'll try to answer questions about the technique in the comments, but we'll stop with that for today. That's how we design the zirconia membrane. if you're interested in the courses, sign up, go to the website, check it out. And if you're interested in submitting lab cases for guides, zirconia membranes, any of that kind of stuff, we're not a big production lab. We're not going to do your individual single crowns and that kind of stuff. We're an implant focused lab that kind of specializes in very unique and complex stuff, off the wall things like this. So if you've got a harebrained idea that you'd like to see come to reality, we would be some great people to talk to for that. But anyway, that's it for today. Appreciate you joining me, and let me know if you got questions. See ya.